My name is Gabriela Petrof and I work at Great Ormond Street Hospital with Dr. Anna Martinez and as part of a large team looking after children with all types of EB, epidermolysis bullosa. So I first got involved in EB back in 2010 when I was working with the general malaria and Professor John McGrath, and I started doing research initially with the adults with the condition, and then later on when I finished my training for the past almost 4 years now I've been working here with the team, and it has been an amazing experience. So my experience with EB really has been, well, transformational from my own personal perspective, and again I'm sort of learning every day from the families, the children, which is there's so many aspects in terms of how the condition really affects their lives. I mean, it is a condition that not many people really can manage or get involved with. It's not just about the medical aspect. I mean, you do become really involved in their lives, you live through them, again from the beginning, from the moment they're born really up until either the transition or later on in life as well. So it's a daily, it's not a job, you know, it's really how part of your life it becomes EB, and they really depend on us as well, depend on the team, depending on people that really know about the condition. And although there are no definite answers or treatments, they always come back to us, and either for the reassurance or for guidance what they can do. Daily challenges, it's again having the answers, which we usually don't have, depending on what the symptoms are. Usually if it's pain or if it's itch, we don't have good treatments for these symptoms, and we are left in a difficult position knowing that we don't have, you know, very good medications for it. Equally, we do learn, I do learn from the patients as well, in terms of things that perhaps I think they wouldn't be able to do, but actually they do surprise me and they manage to do it. Your outside and the inside as well. So every aspect of your daily activities is really, it's affected by EB. So the way we walk, having a shower, having a bath, eating, even talking, all these aspects are really, really involved in EB. The skin fragility, taking a lot longer, for example, to move from one place to the other, needing assistance and needing help from others to do everything really, and having that that sort of fear that perhaps your skin will be damaged and that will cause you additional pain. And again, the itching, just not being able to maybe participate and go out with their friends or go to the cinema, how any other person would do. So all these things are really, really affected by the condition. Again, we talk about being a multi-system disease, so it's not really just about your skin, which is really, really obviously affected, but the inside as well, because it's on the inside. Sometimes people don't appreciate it so much because they can't see it. But again, the swallowing, multiple blisters inside their mouth, issues with their teeth, not being able to use their tongue even to speak or eat. Again, the eyes, having problems with blisters on the eyes as well. Again, going to the toilet, that's a big problem as well. And obviously because they don't move so much, again, the bones can be affected, they get weaker, so they get constant pain from that. Obviously always being a risk of infection because of the open wounds, to all these aspects. Again, when a baby is born with EB, meeting that family, I mean, the nurses meet the family first and then we meet them after that, but having that initial engagement, I mean, the trust and the whole relationship that gets built from the beginning, it's really essential. And then the families always come back to us, again, as I said, for reassurance or guidance. And especially the first few years are very, very difficult. I mean, for the family, getting, you know, or even realizing about the condition. They don't know what to expect, no matter how much you try to describe it, unless you have a baby with EB and you're living with it and having to manage, because every family is different as well. So there isn't any kind of template that everyone is individual. So it's very, very individualized care as well. What really is the right thing for the family and for the baby as well, and just really a different stage of development when they start walking, when they have to go to nursery school. Again, having the team around them to support them. Again, the growth is a very big issue as well. So again, supporting them with growth, making sure they get the nutrition, trying as much as possible to prevent complications or delay them. And again, having to do that on a daily basis with the family. My wish would be that someone meets someone with EB, meets someone with a condition, and actually have a conversation what it is having all these aspects of EB. How is it about going out, getting out of bed, looking after your skin, making friends? I think having that conversation would really give a different perspective about life, about what is important really, the things that we take for granted, but we should actually value a lot more. And again, being here for people to trying to help them really, any kind of help, whether this is medical knowledge, whether it's being able to, assist them, taking them to do an X-ray, for example, but any kind of assistance that can be provided, I think that's really, it's something. I think it will make us better people if we knew someone with EB and have managed to have this sit-down conversation with them.